Your job as an aged care worker must focus on the aged care context. This means you should know about aged care's current strategies and views. You should also know the processes and procedures related to caring for older people. Care for older people differs from care in other sectors. In this video, we will look at person-centered approaches in aged care, including autonomy, choice, empowerment, dignity of risk, and support versus care. These concepts come directly from your learner guide, pages 63 to 76, and they are essential for working effectively and respectfully with older people. As the name suggests, person-centered means putting a person at the center of their care. This means seeing them as a person first and not as a case. The person-centered concept aims to protect the rights and dignity of a person. It focuses on matching services to meet a person's needs and wishes. For example, using a person-centered approach will give the person the power to choose. You can let them choose what activity they want to do or where they want to receive services. As an aged care worker, this means asking before helping, listening to the person's preferences, respecting their decisions whenever it is safe to do so. Even small choices, like what to wear or when to shower, help maintain dignity and independence. Using a person-centered approach in aged care provides the following benefits: minimize the functional decline of older people in hospitals, increase patient and carer satisfaction, decreased healthcare acquired infections, improved functional status. In providing person-centered care, you should do the following. Autonomy refers to a person's right to control their own life. Self-determination means a person has the right to make their own decisions, set their own goals, decide how they want to live. In aged care practice, this means asking permission before assisting, respecting decisions, even if they differ from our personal views involving the person in planning their care. Supporting autonomy helps maintain dignity, confidence, independence. Supporting choice means helping people make informed decisions rather than making decisions for them. Empowerment occurs when older people feel heard, respected, in control of their daily life. Examples include offering options rather than instructions, explaining information, clearly encouraging participation in care decisions. Empowerment leads to better well-being and stronger trust between workers and clients. The dignity of risk recognizes that taking reasonable risks is a normal part of life. Older people have the same right as anyone else to make choices, take risks, learn from experience. In aged care, this means balancing safety with independence, not automatically preventing activities due to age-supporting choices while managing risk appropriately. Removing all risk can reduce dignity and quality of life. Care often means doing tasks for a person. Support means enabling the person to do as much as possible for themselves. Person-centered practice focuses on support, not dependency. Supporting independence helps older people maintain skills, confidence, and purpose. As an aged care worker, applying these principles means respecting each person as an individual, supporting autonomy and choice, encouraging participation and independence, promoting dignity, empowerment, and well-being. These principles guide how we communicate, support, and make decisions every day. Person-centered practice is the foundation of quality aged care. When we uphold autonomy, support choice, and respect self-determination, we help older people live meaningful and dignified lives. You may now reflect on this learning and continue with your assessment tasks.